So I want to thank everybody for joining us today, taking some time out of your crazy, chaotic schedule to learn about building supports for people with companion animals and supporting the human-animal bond and bonded families. So we have two lovely people with us, Zoe and Janet, and I will pass it over to them. We'll discuss some housekeeping and things like that, and we'll take it away.
Awesome. Thank you so much for having us. I'm Zoe, and Janet is also on the call with us. You should be able to see her beautiful face. So just a little bit of housekeeping. I always like to start my quotes off with do the best you can, or my webinars off with do the best you can until you know better. Then when you know better, do better. We're always learning, and I personally always learn when I provide a webinar. I learn from the audience because they share their personal stories and experience when working with pet owners, and they share tips and ideas. And so I really love for these to be very collaborative. And if you have input that you would like to add, we'd love to hear from you in the chat box. We're also going to have a couple of activities where you'll be asked to engage with us through the chat box. So feel free to participate in those as well. You'll see that there is an opportunity for you to engage in the chat box and then also the Q&A. We're going to try our best to get to all questions. We have a lot of information to cover today. And so if we don't get to your question before the webinar ends, just know that we'll do our best to reach out to you via email so that we can answer your question at a later date. And you'll see too, just as a reminder, if you have any input or things that you'd like to share as far as your experience or stories, be mindful of confidentiality, but also feel free to put those in the chat box. And then we have a separate section for Q&A. If you have any questions, please go to the Q&A area because that allows us to better look for questions, make sure that we actually get to them, make sure we answer them. Anything that I forgot, Janet?
No.
Okay, great. All right. Well, I'm going to dive in and hand it off to Janet for our objectives.
All righty. So all of you are very busy folks, and objectives are basically the takeaways. What, having invested your time and your energy, this afternoon, what are you going to walk away with? So I'm not going to read each of these to you verbatim, but our goals for ourselves is that when you leave this webinar today, you are able to state one of each of the four types of benefits, the way people's relationships with their animals benefit them biopsychosocially, that you are able to identify at least three specific risks when we as social work practitioners and other human health and social service practitioners aren't um, recognizing and being responsive to people's relationships with their animals. And then of course, so now we recognize that we need to respond. What do we do? How do we support and help folks become empowered to get through their situations, keep their animals? So strategies in direct services, and more macro strategies, community level strategies. Next slide. We already introduced ourselves. It's my dog Henderson. He gives a lot of benefit to me. However, I actually came to this work. So I worked as a case manager in community mental health, a crisis clinician, a whole bunch of different hats I've worn. I was an academe. Now I'm director of veterinary social work for Open Door Veterinary Collective, which is a national nonprofit that helps to reduce barriers and increase access to veterinary care and other supports for folks who are historically marginalized or vulnerable, and their animals, to help keep them together. How I actually started, I guess, really being deliberate about focusing on this was back many years ago when I was a crisis clinician doing suicide risk assessments. And one question I always asked, those of you who do risk assessments know it's not my question, it's It's, right in how you learn to do risk assessments. The question being, what's stopped you up until now from not acting on your suicidality? And I got the kinds of responses that we were trained to expect in my degree training and continuing education and supervision. Things like, I couldn't devastate my parents. I wouldn't, leave my kids. I don't know what would happen to them. It's against my faith or my spirituality beliefs. However, often enough that it gave me pause, no pun intended. And again, not going to surprise anybody on this webinar, I don't think, were the folks who were saying, I can't leave my animal. And like two things about that hit me. The first being, as a quote unquote animal person, like I got it. I got how that could be a powerful enough tie to keep somebody hanging in there. As a human service professional and clinician, the other way it hit me was, my goodness, like nowhere in my training, my education, my continuing education back at this point, this was like the mid 90s, had this been even brought up that we should be, paying attention to asking about, let alone supporting people's relationships with their animals. And yet on a regular basis, not just me, but my colleagues on the team, regular basis being told that people were literally still alive and talking with us because of their relationships with their animals. And that got me thinking, both as an animal person and a social worker, how do we support this and, help mobilize this strength in people's lives? So it's not about being an animal person. It sure does help, but it's about being a competent professional that is responsive to the strengths and the stressors, because every relationship, people or animal, we've got both. So that's how I'm here in front of you today. And thank you for being with us.
Yes, thanks so much for joining us today. And thanks, Janet, for introducing yourself. So my name's Zoe, and I use she, her pronouns. I'm the Director of Engagement and Program Development at BestyBnB, and my background is in both animal welfare and social services. So way back in the day in my 20s, I worked in animal welfare and many roles in animal shelters. You name it, I probably did it. My favorite one was probably vet teching. But one of the most memorable moments I've had was when I was managing the owner surrender program, where folks would come in, and I worked at to relinquish their pet. And I worked at an open intake shelter, which meant that anyone who was coming in to surrender their pet could. We could not turn away anyone who lived in Kansas City, which is where I'm located, and wanted to relinquish their pet to the shelter. And so one of the clients that I worked with said that, it was a son bringing in his mother's pet, and the mother had written a really sweet note of just about, how wonderful the dog was and how incredible, what an incredible companion it was, and how she was really devastated to have to surrender it, and what a great family dog it would make for somebody. And I could just see how much this person loved their pet, and I couldn't really understand why they would want to surrender their pet. And so I asked, the son, like, is there anything that we could do? Like, what's preventing you guys from keeping your pet? Is there anything that we could do to help you, support you in keeping your pet? And I asked if I could call his mom to talk with her, and I called, and immediately she started crying, and she just said, my husband will not let me keep my dog, which at the time, I didn't really have the education on domestic violence and coercion to really understand what this meant for this pet owner, for this family. But I knew like a bang, a light bulb went off in my head, where I was like, this is a red flag. There's something going on that makes me feel like this family isn't safe. But there wasn't really anything that I could do. All I could do was just, take the dog. And through there, it really made me realize what a connection that pet ownership has on the, the health and well-being of our community, but then also on families. And from there, I started working at a domestic violence agency and managed their pet advocacy program, supporting survivors of domestic violence in both leaving abusive relationships while keeping themselves safe, and keeping their pets safe. And I managed our pet advocacy program by providing co-shelter on site, and then also for our folks who weren't able to access shelter, providing resources for them to keep their pets safe while they were seeking resources outside of shelter. Using all of that, I support our organization, BestyBnB, to partner with nonprofit organizations in expanding or creating pet advocacy programs, and help them navigate creating policy and procedure, navigate unexpected challenges, or just, like day to day, where do I get dog food? So yeah, just a little bit about me, and I'm so glad to be here. And again, thank you guys so much for joining us this afternoon.
So we want to start with a quick check-in. If you could just respond in the chat with a yes or a no, or even a Y and an N. Have you worked with a client who expressed to you concerns about their pets?
We're seeing a lot of yeses. Someone even said daily. The majority of folks responding are saying yes, yep.
Okay, so sounds like in this group here, this is not going to be a real hard sell. When I talk to groups, if I'm meeting with like human healthcare administrators, or groups that are much more, this is a newer idea to them, that paying attention to their patients or their client, being patient-centered, means paying attention to people's relationships, including those with their animals. Spend a lot more time explaining how and why that's important, but it sounds like this is straightforward. So what, from your experiences, again, feel free to put it in the chat, but let's say you're talking to an administrator or a policymaker, and they're like, well, why should a human service or a human healthcare provider be responding to people's issues with animals? Anybody have a thought? I know it's sort of a brainer on the one hand, but understanding the importance of the human animal bond. Yes, it is a family systems. Yes, this is great things popping up in the chat. Wonderful resources. I want to keep all of these, because a lot of times that's where it starts for us. These are great. People put the animals' needs ahead of their own. Yes. Animals as your bridge to the person, incredible way to connect with somebody that may not be willing to connect with you for themselves, but they'll do it for their animals. And yes, there's what's called One Health approach, which is the idea that there are interconnections between human and animal and our environment, the places that we live in, from community all the way to planet, and that when we build on the benefits between these connections, we actually can maximize the positive outcomes. And going back to simply put, if we're talking to folks in human healthcare or social service, there's two main rationales. One, from, again, this is a human-centric side, is that there are a lot of benefits that are emerging in scientific literature around having animal companionship, living and having interactive relationships with non-human animals, benefits physical, psychological, social, emotional, protective factors in people's health. Also benefits that can help to mitigate existing health issues. So benefits of human animal bond for people and animals, if we're looking at it through a One Health lens. The other is it reduces risks for people. People delay healthcare, people delay leaving domestic violence situations, people delay evacuations, people experience psychological and emotional distress, like the story that Zoe shared with us, when they are forced to separate from an animal who for them is a beloved family member. There actually was just an article last month that came out, that a peer-reviewed research article that reviewed what they called forced separation. So when people didn't want to part from their animals and the negative impacts. So why do we want to recognize and respond from a human-centric view? We want to maintain those benefits. We want to reduce those risks. Next slide.
Yeah. So let's talk a little bit about like kind of the population that we're working with and why this is such an impact on our population. So in America, these statistics are from America, but in America, 1 in 5 adults will experience mental illness, and 1 in 10 Americans reported having substance use or substance use treatment, or needing substance use treatment, or having a problem. And then we're looking at about 66% of Americans who own pets. So what we're seeing is a big overlap of people who are needing services, who have pets, who may not have the resources available that they need in order to access those services because they fear what will happen to their animal. I also wanted to note too, somebody in the chat said, I think people struggle greatly when their animals are sick or have behavior changes. Absolutely. I think that is such a significant part of pet ownership, is not knowing, when your pet may be harmed because they can't communicate it to you, or not knowing how to address those issues. And so what we're seeing is a lot of people who are struggling with pet ownership, or facing barriers with pet ownership, but not having the resources available in their community to support them.
Yes. And then when we look at, historically marginalized groups, there's even more barriers, system level barriers. And, economic data, a lot of households being a couple paychecks away from financial crises. So it's not a niche. Again, I really emphasize this is about being a competent human service provider. Expect that most folks we work with, are going to have relationships with companion animals that may be very, very important to them. Good news is we are not alone in dealing with this. Zoe, shared her background, and she's one of the many amazing folks who sort of has a foot in both worlds. There is a whole other sector, the animal welfare sector, who has overlap in their goals, right? They animal homelessness prevention, I guess is but keep the animals out of shelters and in loving homes. No animal shelter. I'm not certain of a lot of things in this world, but I think this is one of them. No animal shelter would want to take in an animal, take them away from a loving, good home that is just temporarily being disrupted, and with supports and resources could be, that relationship could be maintained. So for keeping us, in our lane, we're human service providers, most of us in this call. So we're not dog trainers, we're not veterinarians, we're not animal welfare professionals, but just like we collaborate with other groups, other kinds of professionals when our clients experience a barrier or a need, we have the animal welfare sector out there, and they're doing all kinds of amazing innovations to keep people and animals together. In terms of terms, there's pets, there's companion animals. Pet is actually older, I believe it's a Gaelic term, cherished person or animal, but often, now is associated maybe more with ownership. Companion animals is newer, refers more explicitly to the animal as a companion. We are kind of reclaiming pets as cherished family member, and use that interchangeably with companion animals. What is a companion animal then? These are animals who share our homes and our lives. We have ongoing interactive relationships, and through those interactions and the relationships we have with them, there are the benefits that those relationships and interactions provide us. Again, very significant part of why human service people need to be paying attention to human animal relationships. And one of you mentioned this in chat, for many professions, social work in particular, but others, we talk about starting where the client is at. If the client or patient considers their animal to be family, we're not about the profession is not about defining for people who their family is, chosen family. Evidence that people are considering animals family. We're seeing animals included in protection orders and domestic violence, custody. States are increasingly recognizing that property division law does not work. Like my animals, I have 6 amazing animals. If we tried to put a monetary price on them and sell them and divide that, if, heaven forbid, my wife and I were splitting, like that just doesn't translate because that's not the relationship we have with them. Can you think of other evidence? Inclusive housing initiatives, yes. And I love that word, pet inclusive. There's pet friendly, which is great, but pet inclusive is, I think, even more proactive. What else? So we got portraits, right? Holiday cards, animals in wedding parties. I saw some article research where they were looking at animals included in obituaries. So again, people can have opinions about this. As human service providers, that this is where our population is trending, if we want to use a social media term. So we need to be able to be competent in working with folks who value this. Next slide. There's 2 ways, if we think about the benefits that the relationship and interactions with our companion animals or pets can be helpful or kind of quote unquote therapeutic for us. And I'm using therapeutic, like if we looked it up in Merriam's, it would be like to improve well-being or alleviate aspects of a condition. So broadly, this isn't a clinical definition necessarily, but the 2 main groups of benefits and research that come from animals in our lives that we live with: natural, so that's that everyday, like living with the animal, having a relationship, interacting. Not trained. I mean, we may do training with the animal. Like I signed up for a scent class with my dog Henderson just for fun. We're just to do something with him. But that's not what the reason why having him in my life I consider beneficial. The training is not necessary to get the benefits. The other, and I think what is much more recognized in human health and social service, is what we call task trained benefits. These are the animals that, in addition to the natural benefits that they can offer, they are taught to perform specific tasks and behaviors that help to mitigate aspects of a person's chronic health condition or disability. So I think the most famous example, or the most that people are familiar with, would be like what's called a guide dog, a seeing eye dog. This is a animal that's trained to help a person navigate, the dangers and obstacles out in public, and helps, reduce impairment, increase independence related to their visual impairment. And what are other kinds? These are referred to as service animals under the Americans with Disabilities Act. And these task trained animals are the only animals in therapeutic roles in the United States that have a person with them, has public access rights, which means they have the right to go in public space. What's public space? We go to a restaurant, you have a service dog because you need to serve it. That's public space. Can we go in the kitchen? I'm like, I want to watch the chef. I like cooking shows. No, that's not public space. Your dog, you and your service dog and me by myself can't go there. So public space is like, where can we go as the general public? Anybody think of any other service animals before we move?
I also have worked with clients who their animals trained to alert them when they had low blood pressure or low blood sugar because they had diabetes.
Medical alert.
Yeah.
Thank you, Zoe. Low blood sugar, seizure alert, POTS, seizure effects. Yeah, PTSD. The Veterans Administration of the United States just started covering PTSD trained dogs. who learn, or who are taught to respond to specific PTSD symptoms to either help comfort, down-regulate the person's nervous system, distract, but they are taught to do things just like a hearing alert. Yeah, I mean, just lots and lots of that. Environmental allergies. Oh yeah. Okay. So you all have seen this. Yeah. They're the only ones that have their people with them have public access rights.
Yeah.
However,
Oh, go ahead.
most
Sorry.
folks, out there in our sort of population, if we think in a public health lens or a macro lens, most folks don't have service animals, they have pets. And there are health benefits or therapeutic benefits there as well. Next slide.
Yeah, and I just there's a question in the chat about seizure alert dogs not being part of ADA certificates. And I just want to mention that, service animals and emotional support animals, all of the above, can be kind of like a complicated, complicated kind of endeavor. And so that could be a training all on its own. And I do provide training on kind of navigating services when you're working with emotional support animals and service animals. And so if you'd like to learn more about that training, you can visit BestyBnB's training website, and I can put that in there.
And we'd also be happy to talk. Seizure alert dogs, if they are trained to alert, would fall under service animal. They're trained to do a task. So I'm not sure why they would not be but I'd love to talk more about that. As Zoe said, that's a whole training that there's so much need for that information. And when we think about being human, human beings, like, we have different dimensions to us, like in social work, education degree programs, we talk about the biopsychosocial model. Why? Because those are like 3 main dimensions of being human. Of course, in reality, we're all blended together in one, kind of human person. But if we think about, the things that affect our health, it's the intersection of these different dimensions of being human and human functioning. Next slide. And the research that is starting to build around benefits of animal companionship, we can organize. And again, there's overlap, there's interconnection. We separate these out for study, but there's physical, there's psychological, there's social, and there is emotional. Physical has contact, so like touching, cuddling, holding, even gazing has benefits that can affect us physiologically. And then, of course, there's activity. We see the person walking the dog. Psychological, we'll go through this more, but you see a person feeding a cat. There's feeling needed, having a role, self-efficacy. Social, divided into, again, 2, direct. This is animal as companion. You see person and their cat kind of having a moment together. That's companionship, direct. However, animals also connect us to other people, and we'll talk more about that. And then probably the most intuitive is emotional, comfort, affection, a source of joy for us when they're doing their butt talks or having kitty zoomies or whatever we call them. They provide emotional benefit to us. Next slide. So,
Great.
Zoe, take away.
Yeah, so the physical, as Janet mentioned, can be contact related or activity related. So snuggling, petting. If you have other ideas of ways that pets improve our physical health or our mental health through contact and activities, we'd love to hear from you in the chat box. But this is a graphic from NPR, who did an article on the ACE test, the Adverse Childhood Experience Test. And this graphic really maps out the impact that trauma has on our behavior, physical and mental health. And what we know is that pets can have a great impact. Physical activities or contact-related activities with pets can have a great impact on our behavior, physical and mental health. And so looking at this graph, we'd love to hear from you of ways that you think that pets can positively impact trauma survivors. So for example, when we have pets, we're more likely to be physically active. So trauma survivors are less likely to have, are less likely to be physically active, have a lack of physical activity. And when we have pets, it can positively impact that. And so what are other ways that pets can positively impact our behavior, physical and mental health? I'd love to hear from you in the chat box.
Yes, HPA axis modulation. So helping basically work with, like, affect our stress response. I know there's some of you in here that do work specifically on that, and I love it. But you know, our physiologic stress response, you know, fight, flight, freeze, when we're you know, having an interaction with an animal that we're experiencing as calm, pleasant, affectionate, that actually changes what's happening physiologically in our body, and can change, you know, basically we call it, like, sort of down regulate our stress responses, or
Yeah.
sometimes upregulate if we're in more of a freeze, like, disconnected state. They can help that way too.
Absolutely. Build social
Social connection. Oh, these are fabulous. Again, we're just going to have to save, you know, giving them the motivation and courage to advocate. Love it. Yeah, again, people, we call that sometimes like behavior activation, if we have to use like a jargon term, you know, in like human health, like behavior activation is what needs to be introduced to, or in the situation, to help somebody to care for themselves or do, you know, good for themselves. And our relationships with our animals
Yeah.
motivate that, including advocating where we might otherwise not. And then I saw social connection. Yeah,
Mhm.
helping us, again, that bridge to other people.
So because of those things, we're less likely to miss work. So we're more likely to, you know, get up in the morning, stick to our routine, go to work, build that community. We're less likely to attempt suicide, as Janet shared, because we fear what will happen to our pets if we're not around. People said that physical activities for feeding times and walks, because of that, we're also less likely to experience depression. There's been a lot of studies that show the chemical reaction that pets can cause when we interact with them to raise our dopamine levels. Janet put in the chat box a link to the Heart Association to talk about how pets are linked to decrease in heart disease because of that physical activity, because of that raise of, you know, stress hormones. We're also less likely to experience stroke. While pets can't cure cancer, they have been known to smell it, which is pretty amazing. And sometimes they've been able to smell cancer before someone's been diagnosed. And also can provide emotional support to cancer survivors when they're going through treatment. And they can't cure diabetes, but service animals have been known to be able to alert an owner to when their blood pressure is low, that sort of thing. I love that people are putting in the chat that it encourages routine, provides happiness, comfort, connection. All of those things are really important when we're looking at like community-wide health. And so pets can really support our community in becoming and being healthier.
Yes, wonderful overview on the physical benefits. And that the American Heart Association link, I'll toss it in again. It's in 2013, they came out with a white paper kind of summarizing the research literature. I mean the research team, the cardiologists, public health folks for the American Heart Association, and kind of summarized in 2013 the health benefits specifically around cardiovascular, so heart rate, respiration, blood pressure. Not sure, can't remember if heart rate variability was in there. 10 years later, so last year, they actually launched nationally based on what they felt was an adequate amount of research evidence and support of benefits of animal companionship, what they call the Healthy Bond for Life campaign. So it's a public health national campaign from the American Heart Association, basically encouraging people to be more deliberately interactive with their animals in positive ways. This slide here summarizes, certainly not exhaustively, but just some highlights of what research is looking at and psychological benefits of animal companionship. And I want to caution, a phrase that I heard that I like, not considering pets as panaceas. This, relationship, like every relationship, there's benefits and there's stressors. So this isn't, certainly every person who has an animal. However, just like relationships that are healthy and positive tend to provide benefits, there's a lot of research around that. These kinds of relationships that we have similarly are starting to be looked at, and evidence accrued around these kinds of benefits. So psychological, meaning, purpose, having a role. You see the cat mom and the dog mom and the shirts. Self-care, behavior activation, we talked about that. I love the study Dr. Rockus and Lee did. They were looking at food insecurity, food banks. They hypothesized folks with animals would have more food insecurity. One of their findings was folks were actually reporting less food insecurity when they had animals. Can't remember the demographic. Were they living by themselves? That certainly could be significant. Fortunately, they did qualitative interviews to find out why this difference from what they were expecting. They were thinking, that the animal would be taking, food from the person. What they found was activation. People became more proactive in seeking out food resources. They were willing to let themselves not have enough, but they were not willing to have their animals not have food. We talked about routine, which can help psychological functioning. A couple studies came out the end of last year looking at older adults who lived alone with pets and were matched with older adults, and the folks with animals reduced cognitive decline when they both sets having neurocognitive disorders. That's basically what we used to call dementia. So interesting, lots of reasons we could put in chat. Why do we think that is? Is it more interaction? Is it something else? The stress reducing. Don't know that yet, but interesting findings. So psychological. And of course, when I started, I talked about suicide reduction. That's anecdotal, what I shared, but there are peer-reviewed studies coming out that support that. And my guess is in this group, we would have anecdotes. Next slide. Social, and a number of you already hit this really well. Connection. We talked about direct benefits, helping to reduce loneliness. Is having a non-human animal companion the same as a person? Of course not. Almost like another Venn diagram. Can you talk about the latest show you're streaming and how bad the character development was, and you think it was, not? No, of course not. However, there are benefits where there's overlap. Companions, somebody to do something with, somebody to come home to, and even, in some research showing, folks feeling kind of like more of a social safety with animals, less judged, unconditional. And then of course the indirect benefits, that bridge to other people, ranging from, showing a cute cell phone picture of your animal or video to somebody seeing a kitty in a window. I in my study, folks adopted cats, and actually a couple people met people in their building. They'd lived in their building for years, but because of their kitties in their windows, when they were out of their apartments getting mail, or going out run an errand, they met somebody, and that can range from a casual pleasant meeting to one of the participants has an ongoing friendship, last I knew. Extending that out in a community, we call that social capital, more connectedness. And of course, dog walking. How many of us probably know the names of dogs in our neighborhood and maybe the people, but we have pleasant interactions. Wood the last bullet there kind of summarized it as pets can catalyze human relationships, community to individual. Next slide. And then Zoe is going to talk more about emotional, which some researchers kind of put with psychological, but because emotions are, specific feeling kind of states, we felt it was, is important to kind of separate that out.
Yeah. And I think as we saw in like the graphic where, all of these things are kind of interchangeable and also connect to create a bigger picture of how pets positively impact our health. But pets can be a protective factor in someone's life. We've mentioned this several times, but it prevents us from a lot of people from acting on suicide plans. When I was providing services and advocacy for domestic violence survivors, it was pretty regularly that a survivor would disclose that, if it wasn't for their pet, they wouldn't be here. They were, considering harming themselves because the abuse was so bad. And their pet really gave them a reason to stay around. So pets can be incredibly important during those incredibly difficult and painful times. Pets have the ability to alleviate worry and provide comfort. So, when we're having those distressing thoughts, when we're having intrusive thoughts, pets can help us stay present. They can be a pleasant distraction from mental health concerns. I worked with survivors who, some of the survivors I worked with, the trauma was so incredibly significant that they would disassociate when triggered. And it was really hard to get them back to the present, to, come out of that triggered dissociative state. But when we had clients who had pets, it was pretty immediate when we introduced the pet into the situation when they were feeling triggered or dissociating. When we introduced their pet into that, and it helped them immediately come back to center, immediately come back to reality and be in the present moment. And so it's really important to, when you're providing services, especially to trauma survivors, to use their pets as a tool. This domestic violence agency that I worked at saw such an incredible benefit of the pets to the pet owners, that what they did is they took steps towards having a therapy animal be on site for anyone who was experiencing triggers or needing the support of a pet, to be able to work with and stay with, to pet and interact with the therapy animal who was owned by one of the staff members and had a job at the domestic violence agency. And so any client, whether or not they had a pet at the shelter, was able to have the benefits of the pet interaction. This is a video that I'm going to share about just how dogs in this instance are able to read our emotions. We know that pets in general, when we're bonded with them, and sometimes even when we don't have a specific bond, are able to engage in, kind of reading our emotions. When I'm upset, for like a personal example, when I'm upset, my cats will come and lay next to me or purr really loud and lay on top of me. I worked with a client who had an emotional support bird who, when she was upset, it would crawl up onto her shoulder and nuzzle into her neck and kind of chew on her ear. And so we know that animals in general are able to respond to human emotions. But this study specifically focuses on dogs. And so I just wanted to kind of give that heads up. So that was a video or a clip from an episode of Nova. The episode's called Decoding the Dog. If you haven't seen it, I highly recommend it. It's really interesting. One of the studies that they show is they did a study on how to domesticate dogs. And we learned a lot about animal features and domestication through that episode, or I did. And so highly recommend it if you get a chance to check it out. But again, more than just dogs are able to read our emotion. I think it's really cool to watch and see how that study was done. And I've seen this clip a few times, and every time she says Moose, it always makes me laugh because Moose is such a perfect name for that dog. But moving on into Have you ever had a client refuse or delay needed treatment or services because they didn't have care for their pet? So we'd love to hear from you. And if you want to just say yes or no, we'd love to hear from you. Or if you want to share a little story, we'd also love to hear any experiences that you may have had. But again, have you had a client refuse or delay needed treatment or services because they did not have care for their pet? We're seeing a lot of yeses. Yes, frequently. Yes, yes. I know I personally have had this experience where I've worked with clients who really needed substance use treatment, but they were fearful of their pet and of someone being able to care for their pet, or they had a job opportunity and there was a training that they needed to go to because of needing to train for promotion, but they didn't have someone to watch their pet while they went on this training. Folks have said, I've had patients prioritize food for their pet over purchases when facing financial challenges. Yes. Another folks said, yes, and in a way could be a protective factor. Absolutely. I've had a client who would actually not go to medical appointments to get important psychological meds because of not having care. Yes. An 80-year-old woman lived alone, needed emergency hospitalization, but refused to go to the hospital because she had no one to look after her dog. So we know that this is a common factor in our experiences when working with clients, is that people will refuse care or services because they don't know what will happen to their animal. And so this is a common risk. When admitting consideration to clients' companion animals, we know that people will delay or refuse services. People will not access domestic violence shelter because they fear what will happen to their pet. People will refuse evacuation. And people will, like Janet said before, will experience distress and trauma when forced to be separated from their animal. There's an awesome story that comes from Hurricane Katrina, where there was a sweet pig. Someone had a pet pig who originally they thought was going to be a miniature pig, I think, and soon they learned that miniature pigs weren't really a thing. They had adopted a baby pig that was tiny, that then turned into a gigantic pig. Luckily, they had the resources to be able to care for that pig, but that pig lived in the metropolitan, lived in a neighborhood, went for walks, was a big part of this family. And when Hurricane Katrina hit, the husband of that family decided to hunker down and stay with the pig. And the flooding happened. We all know what happened with Hurricane Katrina and New Orleans. And yet he still stayed with that pig. And when it was finally time to be rescued, the rescue crew came to get him. He said, I'm not leaving that pig behind. I'm staying with this pig here. I don't, you can't force me to leave. And then they finally found a solution. They found a way to remove that pig from that environment, and found a safe place for that pig to go. And it had a happy ending where that family was able to keep that pig. But this is a great example of how people are not going to leave their pets behind, even in emergency situations.
Yeah, and I just dropped, thank you for sharing that, Zoe. Hurricane Katrina was a turning point. So many people refused to evacuate because they were told they had to leave their animals behind, that federal law was passed that requires municipalities to have a plan in place for pets in order to get FEMA funds. Let's see, is there trouble hearing me? Yeah, I'm not sure what happened here.
I can hear you just fine.
Okay.
Once you moved a little closer, it sounded a little clearer.
Okay. Good.
Finding
Good.
the right distance.
Yes, definitely. Thank you. I dropped in the chat an article that just came out at the end of last month. That is, we mentioned a couple times, a review of the human impact of forced separation from pets. So a review of like peer-reviewed publications. This could be helpful in grant applications, or discussing inclusion of pets and human-animal relationships in aspects of your agency practice. So That's what's in there, and the full access to the entire article is actually available, which is always nice. So the idea of providing support to help keep people and animals together actually is not new at all. In this country, it dates back to at least the 1980s AIDS epidemic in California, San Francisco, through a human service nonprofit organization called the Shanti Project. And at that time, they were working a lot with folks with cancer, which was actually still a stigmatized diagnosis due to not understanding transmission and so forth fully, and the idea that it could even be transmitted, person to person was still a question mark for some folks. And of course, AIDS at that point, very stigmatized. And Shanti Project stepped up and supported what was really a grassroots organizing effort to help folks who were living with AIDS and becoming more ill and impaired to care for and keep their animals as long as possible. And they coined this phrase human animal support services with the slash between human and animal. This is sometimes also referred to as the San Francisco model. So major human health crisis in the 80s, throughout 2000s, 2010s, domestic violence sector really emerged with co-sheltering models, still not the norm, but increasing temporary fostering, really recognizing, the importance of getting, helping that person trying to leave a violent situation to keep their animal family member in a safe situation. COVID, another major, in this case, worldwide pandemic, human health crisis. And there was a rapid expansion of human animal supports and even specific organizations founded in the animal welfare sector, and whole collaborations on the animal welfare sector side focused on keeping people and their animals together. So rich history here, and as we move forward, a number of different models and types of what we call human animal supports have emerged.
Yeah, and so some of those supports may look like housing assistance, as Janet mentioned, temporary foster care of companion animals. So when folks are experiencing homelessness or experiencing the crisis of domestic violence, then providing a temporary placement for their pet through a foster network can be great. Co-sheltering is a term, I think it was termed by My Dog Is My Home, and it's where people and animals are able to stay together in shelter, whether that means the pet is allowed in their room or that organization has a separate facility on the same grounds where the pet owner can visit their dog at any time. Accessibility and affordable vet care can be a real support needed. Many organizations and many metropolitans are focusing on providing low-cost vet care because vet care has just become so extremely expensive. That even someone making, a livable wage may not be able to afford veterinary care anymore. Pet food banks are becoming more and more accessible as well. Many human food banks are now providing pet food as well. I know that Harvesters is a food bank here in Kansas City that was extremely active during the pandemic. They saw a great increase in requests, and during the pandemic, they more regularly started to provide pet food as well. Grooming and training support can be an assistant or a support. Assistance with pet supplies. One of the organizations that BestyBnB partners with is Pet Resource Center of Kansas City. And one of the really cool things that they do, in my opinion, is that they help with supplies on a regular basis. And so if you sign up for their organization, it's not just a one-time support. They will provide you with food, cat litter, any supplies that you need in order to provide the basic care for your pet on a regular basis. And they have two options where you can go to their facility to pick it up, or if you don't have transportation, they have a mobile unit where they will actually bring it to you. Assistance with care tasks can be real big too. So we talked about how the elderly population really benefits from companionships with their pets, but sometimes people don't have the mobility in order to be able to care for their animal, and so assistance for care tasks can be a good support as well. Transportation also is a huge factor. And Open Door has done Geraldine with Open Door has done a lot of work for the transportation support, which we'll talk about in a little bit, but just wanted to give her a shout out before we got to that slide. So when we're considering all the supports that are available, how can social workers and direct service providers respond to a client's care for their companion, or a client's concern for their companion animal? And we really feel that pet advocacy is one of the ways that you can approach this. Pet advocacy is advocacy for both the person and the pet. This is not just we want you to become now a pet person, you love pets, your whole main focus is on pets. No, pet advocacy is a term that ensures access to supports while recognizing the bond that our clients share with their pets. Pet advocacy can be enacted in 3 different strategies. Number one is recognizing the important bond between human and animals, which I'm pretty sure this whole audience does that already. So thank you for doing that work. 2, finding resources for those in need that support their goals as pet owners. And I think one main thing that I always want to point out is that we can't jump to conclusions or make assumptions or dictate what a person's goal is for them and their pet. And so we want to meet the person where they're at, find out what their goals are as pet owners, and support them in meeting those goals. And being creative in finding those resources, because we know that traditional resources that may support someone who's experiencing homelessness or experiencing domestic violence may not work for someone who has a pet. And then when we experience those barriers for pet ownership, we work towards collaboration for change efforts to support the welfare of both pets and pet owners. We want to build those resources both in a macro way where we're rectifying conditions that create the need, so systems change, but then also in a micro way where we create services to meet immediate needs. We are not focusing too much on the macro side of this, where we are talking about housing accessibility, making pet-friendly ecosystems, and system changes, where we're trying, I believe LA just passed a law that removed pet rent in their city, which made housing a lot more accessible for pet owners. So we're not focusing too much on that collaborative change. We're focusing more on the creating services side in this training. And I'll hand it over to Janet.
Yeah, and really, if we look at levels of change and, sort of the person coming down the burning boat analogy on a river, and the fire is upriver, we really need a continuum of strategies to come at this. So a lot of what we're talking about today is services and support for folks that are right in front of us in the quote unquote burning boats with their animals. And again, all the barriers and concerns are further amplified when we're working with, or we are folks historically marginalized or vulnerable groups, both the downstream inequities, trouble barrier access to services, and the upstream inequities, the systems and the conditions that create the factors whereby people need these kinds of support. So it's a big sort of multifaceted, like most things that we approach in social work practice, but we are going to hit, of course, on some macro strategy. I'm putting in the chat here, Christina Risley Curtis is one of my heroes. She's done some research. She did a national survey with social workers in, was it 2010, and basically wanted to know how many folks ask, just how many folks even know, who of their clients, speaking, for folks who do microclinical, have animals. And how many, you know, of the respondents had like places and forms that actually recognized the relationships. And she found that less than a third did, and the vast majority of respondents had no training, kind of much like when I was talking about, you know, doing suicide risk assessments. It was just a non-issue. Like the idea that we even mentioned pet and social work practice in the same sentence was like, what? So good news again, we're way beyond that, thanks to pioneers like her who really started, you know, raising these questions. I mentioned takeaways and our objectives. If there's just one thing you take from this, and my guess is all, you know, again, the folks that are here are doing this, getting it in our organizations as a practice, you know, so that it's not up to an individual provider to have to remember to ask or kind of add it into a form. But if we add it into like the text of our assessments or our admissions, our intakes, I don't, you know, we all have different kinds of documents, then it becomes institutionalized. It becomes part of that person's record. You know, certainly they can decline to answer. I'm all about people's, you know, rights, choice, privacy. However, what we don't want to do is off the cuff exclude what could be important to support a relationship. So if nothing else, ask, and like ask, okay, what do we ask? Let's say you're talking to somebody and they're like, so what are we supposed to ask? Do you live with any animals, or do you have any animals in your household? Do you have any pets? You know, that the current living with animals is what you're looking for. And then the next two, you know, do you feel the animal's helpful for you? Do you have any concerns or worries? Now we're getting at those benefits. How do we amplify that? We bring in all the time resources and supports that people have in their natural, you know, environments and ecosystems. Let's see if this is happening for them with their animal. Conversely, the animal may be ill, which, you know, those of us that have animals with chronic, I mean, that can be devastating and stressful. Or maybe there's a behavior issue, the dog is barking. You know, grooming was a pet support. I've been asked, like, wasn't that a luxury, you know, to get your animal a haircut? Like, I can't afford haircuts for myself. Where it becomes necessary medical care is like, you know, nails, ears, anal sacs, and then dogs that don't shed, or animal, you know, where they end up with mats, or kitties, long hair kitties can mat too. And then it twists skin, infection. Anyway, a whole bunch of different worries may come up that never would have. Are you then, is it in your scope of practice to like whip out, you know, go to pet supplies and get a pet grooming kit? Or no, of course not. That's where we reach out. We use our networking and partnership skills, and what are the resources and supports in our communities who may be able to help. So asking, and then however we can, getting them in our forms, like the who do you live with spot I've seen people use. Family members, sometimes they just put pet with that. So it's kind of, you know, using your judgment to figure out where that most makes sense. But when it's, and I know there's lots of competing guidelines and things we're supposed to be asking, and policies that require us to have things in our, you know, we don't want a 50-page diagnostic assessment if we can help it. But again, this isn't a few people, this isn't a niche, this is most folks, and it's trending higher. So we really have to be able to proactively, you know, support this as both a strength and a stressor. And just incidentally, this morning, I actually was contacted by a social worker who, Brazil and Portugal. She does a lot of work, and she calls herself pet inclusive, and she's doing trainings on pet inclusive social work practice. So this isn't by any means just a US thing. There's things happening in South America and other countries whereby, you know, the need to be inclusive as a competent professional for human service is being raised. Next slide.
Yeah, and just so that everyone notices, we had somebody in the chat box who shared that, you know, they're trying to start veterinary social work practices in their community, and sometimes they're told it's just, you're just an animal lover with a social work degree. And I think that, yeah, whenever you're doing kind of innovative work, you're going to get pushback. And I think that pet advocacy, pet veterinary social work, etc., those are all kind of innovation and innovative practices. And so, hopefully you won't, like Cassidy said, don't let that discourage you. It just means that you're on the right path, that you're an innovator in your community.
Yeah, you're at the front. We did a bell curve. We all love the bell curve, right? Looks like I have one in the tree behind me, kind of. But you're at the front. You're pulling the curve forward, because what we know is from research data. I've been dropping things in the chat. It's not about. It helps to be an animal lover. It's more intuitive. But just like we know, attending to other aspects of a person's life is important, even if it's not something that we value or experience or understand. Being inclusive of people's relationships with their animals can have a significant and positive impact if we're attentive to it. Conversely, it can have a negative impact when we are not. So that's part of why I spend time kind of talking about, when we talk about One Health, animals, they are benefiting too, or should be ideally. But when we're in our human service practice environments, typically we're interacting with policymakers, administrators, who are looking, how does this help humans? And if they write it off as it's warm and fuzzy, but we're not a pet place, so off you go, Janet. And believe me, I can't tell you how many times I've had either that, or it's nice, that you do animal assisted therapy, but that's not our priority right now. I'm like, that's about this much of what we're talking about. This is most people in the country, and we know this can positively or negatively impact how the outcomes of services are going to be, depending on whether and how we respond. And I'm again happy to talk more, because it is tough. It's hard. It feels like you're kind of brick wall head. Hang in there, and you're not alone. You've got a whole community of folks that is with you and here to support you.
Yeah. And it's
Refer,
about
connect,
accessibility.
network. I'm sorry, what were you going to say, Zoe?
I was just going to say it's about accessibility. Whenever I get pushback, I always say I'm just working towards making services more accessible, and that means making sure that pet owners have access to.
Yeah, and it's accurate. It's accurate. And again, the skills that we have been taught, we just take them and utilize them. Referring, connecting, networking. With the client. Again, assuming they're interested in wanting to have their relationship with their animal kind of involved in their services. If they're like, I don't want to talk about, of course we follow the client's guidelines, but in general, my experience has been people love to talk about their animals, and we'll show pictures if they're able, and kind of, so what are the person's strengths related to their animal, and how can the animal partner? Again, are you going to be able to have a conversation with the animal? You're going to part, but how can that relationship with the animal both enrich that animal's well-being, and of course help to benefit the person? Resources. What's in your community? Your animal welfare providers. Reaching out to them, identifying yourself as a social worker, a healthcare provider, whatever your human role is, and letting them know you're trying to possibly prevent a surrender. You're working on resources. Do they have ideas? And it may be collaborating with local groomers or veterinary. It just kind of depends. We have a phrase called asset mapping. Like, what's in your community? What are the local strengths? Who can be kind of tapped and come together to start to build supports, and then have them proactively, so you're not trying to reinvent the wheel. As the earlier slide showed, there are a range of supports that have been developed, different models around temporary crisis fostering, help with pet food, supplies, grooming, veterinary care, accessible, affordable veterinary care. Posting on, I'm sorry, I forgot social media. Like if there's a Facebook group of social workers or, all that kind of networking is good. In terms of the models and types of services, there's a couple resources because we are familiar with them that we're going to show you as exemplars, kind of case studies of supports that have been developed. BestyBnB, Zoe's going to share with you a bit more about that. That's one of the biggies. My guess is most all of you have had a person that you have worked with that's needed crisis pet fostering. I get emails about that multiple times a month. And where do we begin to search? Most of us know 211. That's United Way's People's database for human help. 211 actually partnered with Open Door, the nonprofit I'm with, to support a new resource. It's completely free to put your service in it if you're animal sector, and of course to use it. It's called pethelpfinder.org. Let's take a look at it. Next slide. This is just a little video to kind of show you a bit. That's the web address. Financially friendly, so not necessarily free, but payment plans, ways to make things more affordable, including veterinary care. So even practices, not necessarily just from humane societies or outreach, but vet practices that offer payment plans, like care credit, other sort of innovative things. There is, again, national and growing. This is an example of the search screen. You see there's the veterinary services, pet food, and the temporary crisis. So you would enter in your city. It is accessible according to the that code standard was up there, multiple language, and the listings are vetted. And here's some of the partners. And again, this is just one resource. I know there's other pet resource databases out there. It would be great one day for them all to be integrated. I am thrilled to have multiple ones to look at rather than when I was a case manager having like my Rolodex and really nothing in there that was getting at what my client needed. So again, pethelpfinder.org. And if you can't find what you're looking for, there is email us, and you've searched, you're not finding, you've tried some of the other strategies, contacting your animal welfare organization, leaders in the community who may do rescue. Maybe they're not even formal nonprofits, but they're community leaders. These are incredible community specific resources. But you can always email us and just be like, hey, like I need help, and we will do our best to work with you to try to find a plan or a resource. And this is showing different resources. I'm sorry, could you go back one slide?
Sure.
That's just an example of a search in, looks like Kansas City, Missouri. So you'll get, location specific. The other thing is to encourage the animal welfare resource providers in your areas to upload so that people can find them. Next slide. So transportation is another barrier. Getting to a pet friendly or pet inclusive shelter, or to pet food bank, different resources. What if your veterinary appointments? Transport is a partnership with Uber, whereby nonprofits can provide transportation that is pet inclusive. It's at the nonprofit would basically work with Uber and subscribe. Geraldine Da Silva, who is in our group with us, is heading that up. It is still a work in progress, but again, recognizing transportation is one of the big barriers to access all sorts of support. So, you know, just one of many strategies that, you know, there's I've seen volunteer, you know, groups kind of take this on and figure out insurance for it. Lots of different strategies, but here is one. Next slide.
All right. So now I'm going to share a little bit about BestyBnB, which is the organization that I work for. BestyBnB is a solution to providing temporary foster. And so I'm going to play this short video, which shares some of our partners that we work with, which are mental health services, substance use treatment, homeless services, domestic violence services, and some of our partners have shared a little bit of information about how they've used BestyBnB.
I've lost count literally how many calls for service I've handled involving domestic violence, where I've had a victim of domestic violence who is in a very dangerous situation, who wants to flee from the abuser but has been reluctant to do so, or absolutely won't, because they know that when they leave that abuser, their pet is going to be harmed or killed.
I'm still amazed at how often this is part of conversations with our callers. And I heard every detail of that dog. Sounds like adorable, but that's the reason that she's living right now. So it's got to be a place that can take that dog all the time. I mean, all the different stories, you know, when, you know, police are trying to assist somebody in getting to a hospital, it's like, but what about my dog? What about my dog?
She has 3 dogs and they're the world to her. And the only way she was going to be able to go into treatment was if we were able to locate a place for the dogs to go.
And when we need fosters for people that are struggling and need hospitalization, or they just need a break, they can call their case manager and then arrangement can be made almost immediately to get that pet into foster care, and they're not in danger of losing the pet.
We can work on a placement for your cats if that will help you. I mean, she just started crying because she said, yeah, they're a bonded pair. I can't leave them and I can't separate them and I don't want to give them away.
The victim left, the survivor left the domestic violence situation, and the abuser said, for every day that you're gone, I will starve your pet.
I don't know. I really like the program, and I like the freedom that it gives clients that are in our community to be able to access that kind of a foster care system.
Now, with the resource of BestyBnB, we can at least know that their pet will be safe, and we can help them to know their pet will be safe during this process to alleviate that obstacle and that barrier.
You know, research clearly shows that owning a pet, you know, reduces levels of depression and anxiety, you know, gives people a reason to live, gives them a purpose. This reminds me of working with women and children. You know, our antiquated ways of doing things was to take that baby from that mother as soon as they were born, you know, and then women and children's programs, you know, residential came along and we're like, no, we need to keep that mother with that baby. We need to make sure that bond stays intact, because we know, again, from research that women tend to be more motivated, right, to recover if they can caretake for their own children, you know, to maintain that relationship. They're highly relational. This is so similar to me, that, you know, to be able to maintain that connection with that pet can be just, it could be all the difference, right, between the will to live, the hope, you know, the extra effort that's sometimes needed, and the obstacles certainly that they face trying to get well, to know that they're going to be reunited with that pet.
So BestyBnB is an online platform that allows domestic violence agencies, social service agencies, like homelessness, those working with the homeless population, those experiencing substance use, or needing substance use treatment. We even partner with animal welfare organizations. So we partner with folks who have either no prior pet supportive programs, and we also partner with folks who have pet supportive programs but are looking for ways to expand their services through our platform. We partner with our agencies to manage temporary housing for clients' pets until they can be reunited. And BestyBnB is not a direct service provider, so we do not provide services directly to a client needing pet crisis services, but our clients are the agencies that we partner with. So when someone reaches out to BestyBnB for support, we refer them to one of our agency partners. We've provided over 3,500 safe nights and have a 100% reunification rate, which means that folks have been able to access much needed services while still maintaining the bond that they share with their pet. We are currently in 12 different states and have 33 partners and are actively looking for people to expand our network of care and for organizations to partner with. This is what the platform looks like when someone has a BestyBnB account. When an agency has a BestyBnB account, they can log into their safe and secure BestyBnB platform to be able to search for a pet caregiver for their client's pet. BestyBnB takes confidentiality and safety incredibly seriously. So all of our pet caregivers have been trained on confidentiality and have been trained to never share any identifying information about the client's pet. One of my favorite features of BestyBnB is that while the client's pet is receiving care and staying with a BestyBnB pet caregiver, the client has confidential communication and direct contact with the pet caregiver. The pet caregiver is never going to know the client's information, and the client is never going to know the pet caregiver's information. So you'll see this is our chat thread between a client and a pet caregiver where they can share updates, they can ask about care, and really this is meant to maintain that human-animal bond, and we believe this is one of the reasons why we have a 100% reunification rate. And so when a client reaches out to the pet caregiver, they'll see a pet caregiver icon, but they're not going to have any identifying information about that pet caregiver. The same thing goes for that pet caregiver. All they'll see from their perspective is a client icon, and the social service provider is going to have access to this entire chat thread to make sure that that communication is appropriate. There's a code of conduct that basically says never share any inappropriate information or any identifying information. If the agency believes that the communication is inappropriate, they can remove access, but we have never had that happen before. I truly believe that this is one of the best features of BestyBnB. I know we're running short on time, so if you'd like to learn more about BestyBnB, I'd love to meet with you to provide you with a full demo of our services. We really feel like it takes a village, and so we want BestyBnB works together with our clients, our agency partners, in order to create pet-friendly ecosystems. We don't want the solution of pet advocacy or pet crisis to fall on one organization alone. And so what's amazing about BestyBnB is that when someone provides services, a pet becomes a BestyBnB pet caregiver, they can provide services to anyone who partners with BestyBnB. And we also work with our agency partners to create coalitions and collaboration. One of the things that we've done through this work, or through my work, is that I created, while I was working at Rosebrook Center, the Domestic Violence Agency, the Kansas City Coalition Against the Co-Occurrence of Domestic Violence and Animal Abuse. And this is formed of social service providers and animal welfare providers to meet and collaborate on service gaps that exist in our community, and for networking to say, if your client's experiencing this, I have a solution for that. And it also gives an opportunity for continued education on the connection between animal abuse and domestic violence. A couple of additional resources. I'm going to let Janet take this one away.
Sure. Realize we're just about out of time. So I'll go real quick. I want to say again, Besty is a shining star in temporary animal fostering. They, are a range of models. Correct me if I'm wrong, Zoe, but there is no cost for the organization to use Besty. It's the sitters that kind of set their fees. So it actually even creates jobs in the community because it's the local community members. So that, if I'm understanding, would be the expense that the nonprofit would, if the pet sitter was charging, then somebody would need to pay that. But the subscription right now, there's not a
Yeah.
fee.
And
Other
well,
models I've seen, boarding, if there's a community fund, having an animal go into, formal boarding, not ideal. But reunification being a goal, partnering with an animal shelter, although, room is an issue, a lot of them are full, but that, they may have fostering or something available. Veterinary practice. I just talked to a veterinarian who was the point person and kind of placed amongst colleagues in the community, and that vet was the only one who knew to help protect in domestic violence situations. So there's all kinds of creative ways to do. And then, oh, I'm sorry, go back 1 second. Like my dog is, my home is on here. They do co-sheltering. So they help shelters develop on-site facilities for pets. Red Rover has grants to help with boarding. Safe Havens has a resource for domestic violence friendly shelters, either co-shelter or temporary. Next slide. And then again, takeaway. Hopefully you're taking away lots. I'm taking away wonderful things from what's been shared in the chat, learning more about Bestie, but asking and getting your colleagues, your organizations to create spaces where people's relationships with animals are recognized and supported. If you need help, again, range of resources, but Pet Help Finder, and then email us if you need help. Bestie, as Zoe said, while of course their expertise in temporary fostering is awesome, they are also willing to help with general conundrums.
yeah.
And
So always
great shout out to International Vet Social Work Association in Augusta.
Yeah, thank you so much for coordinating this and for, hosting a platform for both Open Door and BestyBnB to share about the work that we're doing and the work that's available for folks who are trying to incorporate pet advocacy into their services. And if you guys feel free to, I know we kind of rushed through those last slides, so feel free to reach out to us with any questions about
Absolutely.
BestyBnB or Open Door.
And thank you all for, we know we're all over the country and even the world. Like I said, I was talking to Sylvia, who's working in Brazil and Portugal in her country. Sometimes it feels like we're kind of on our own, but you have a community. So let's connect and lift each other up. Thanks to all of you for all you're doing.
Thank you so much. I know I was getting text messages from some of my colleagues and they're like, this is great. So I really appreciate you guys taking the time today to talk about everything. So yes, definitely reach out. Everything is recorded. It'll be shared on our YouTube channel in a few days, and we'll send that out. And also regarding the survey and quiz, whenever I get notifications that they're completed, I will then mark you guys as attended, and you'll get an email that does say no certification selected, which just means that it's a general social work certificate, and it will have 1.5 hours of CEs on that. And real fast, I can show you how to access that on the platform, because it stores everything. So all of the CEs that we do and that you sign up for, our platform will also hold all of the CE certificates for you, so that you don't have to save them to an email or anything like that. So I can share that real fast. So what you'll do is you will, and even if you're a non-member, you still should have had to create a sign-in. So you'll go to your sign-in, enter it in. When you get onto the back end, there'll be this drop-down tab up with your name, and you can go to account and settings. And then it'll bring you to this page, and you'll see all of the different information, and the professional development will be where it is housed. So you'll see our other event about ESAs last year, that's on here, and it will show up, and you can then see it. And so this will be your formal certificate, and it'll give all of that lovely information. So And obviously reach out at info@IVSW if you have any questions. Thank you guys so much. Appreciate it.
Thank you.